When I was 21 years old, I had the amazing opportunity to spend a year deep in the rainforest of Borneo studying orangutans. It was said at that time that an orangutan could go from coast to coast on the third largest island in the world without touching the ground. And looking out on that view, I could believe it. But even back then, you could hear that hated sound, the sound of a chainsaw. And I knew what would follow, because the trees that they were cutting were so enormous that when they hit the ground, you can literally feel the earth shake in your feet. And even 22 years ago, before Borneo experienced the fastest rate of deforestation the world has ever known, I was wondering, how long the orangutans I was studying would even survive, and would it matter to discover that they were critical for the dispersal of certain tree species if they were extinct? It was easy to hate the loggers and assume that they were evil people. But actually, I got to know many of these men, and they were in an impossible situation. Imagine for a moment that you had a child as beautiful as one of these. Wouldn't you do anything for them? And if they were sick, of course you would want to take them to the doctor. But if you are a farmer and you are only growing a little bit more rice than you need to feed your family, there are very few ways to get cash. And healthcare is one of the only things that you just have to have money for, and it won't wait until you slowly collect it. And sadly, one of the only ways to get fast cash for the people who live around Gunung Palung National Park is to illegally log in the park. One man I know, Pak Sofian, he cut down 60 trees to pay for one C-section. And I'm not talking trees. I'm talking trees that are host to unbelievable biodiversity. Now, eventually, those trees are worth lots of money on the market, but the man who cuts them may get tens to a few $100s per tree. And the thing is, Pak Sofian knows that the forest is critical for his well-being and the future well-being of his family. Like many people around the park, he describes the forest as his mother, and he sees it as the watershed that provides the water for his family and for the rice fields that then feed his family. He also has a cultural understanding that logging the forest leads to more disease. And interestingly, there's research that shows a higher rate of malaria-carrying mosquitoes in logged versus unlogged forest, which supports that cultural understanding. In surveys, we found that 99% of the people wanted the forest to be there for future generations, and 100% of the loggers wanted to quit. But if your child is sick, what choice do you have? What choice would any of us have? So I began to wonder if the best way to save orangutans might not be with one of these. So I went to medical school, and then I did my specialty training in family medicine before returning to Indonesia to do a combined healthcare and conservation program. I started the US nonprofit called Health in Harmony to support the work in Indonesia, and then I spent a year traveling across the islands of Indonesia looking for the right place for this program. I then teamed up with this amazing woman, Hotlan Ampasunggu, and the two of us founded an Indonesian nonprofit called Alam Sehat Lestari to manage the work on the ground. And then we began working with the 60,000 people around Gunung Palung National Park. Now, I did not know how to stop the rampant illegal logging, but there was one thing I knew for certain. The answer did not lie with me. I had been well educated, but that actually made me more clueless. I had been taught to think in boxes. The people who would understand all of the interconnections and know how to solve the problems, obviously, were the people who were experiencing them. So we asked, In the first year, we spent 400 hours listening to the communities around Gunung Palung National Park. We said, you all are guardians of a precious rainforest that is valuable to the whole world. What would you all need as a thank you from the world community in order to be able to protect it? Now, partly we did so many hours of what I call radical listening because I thought every single village was going to come up with a different answer. But no, there was complete and total consensus. Why do I call it radical listening? One, because we do it with radical love and respect. Two, because we do it with the intention of actually implementing the solutions that people came up with. And three, I call it radical because it is a subversion of the normal dysfunctional power structure. It is community-driven change. So what did people say? Well, they said in order to protect the forest and stop the logging, which they wanted to do, they would need access to high-quality, affordable health care, and training in organic farming. Now, I was very surprised by this second point, but people described it in this way. They said, look, the traditional form of agriculture here is slash and burn. That worked really well when there was lots of forest and not many people, and it doesn't work anymore. And we heard that there was a way to plant in one place without expensive chemical fertilizers, and we don't know what it is. Would you please teach us? Well, Holland and I are actually not experts in organic farming, but I like to joke that what is needed in one place in the world is excess in another. On just the next-door island of Java, there is a many thousand-year tradition of sustainable agriculture. And it was relatively easy for us to bring over wonderful Indonesian-speaking experts to do the training. And then, how do we provide high-quality health care in a remote part of Borneo where the training of physicians is developing? Well, in America, there are an excess of doctors who do not lack knowledge or resources, but they often do lack a sense of meaning and fulfillment in their work. We actually have more physicians who want to come over and teach and learn side by side with their Indonesian colleagues than we can even accept. And they pay their own way. These doctors from top US institutions like Yale and Stanford give thousands of hours of free training. And our young Indonesian doctors who are so smart and motivated, in 1 year become excellent physicians. Of the 20 or so doctors who've been through our training program, many now work in hospitals across Indonesia, and they tell us that they are the best doctors in their hospitals. And the thing is, the learning goes both ways. In this picture, it may look like Dr. Ewan Wang from Stanford is teaching Dr. Nomi, but it's actually the other way around. Learning is a lifelong thing, and we all have something to teach each other. And in that process of an exchange of information, there is also an opportunity for a great bonding of friendship. So that's how we do high quality. How do we do affordable? Well, in our clinic, you can pay with all kinds of non-cash means. You can pay with seedlings that we use for reforestation. You can pay with manure that we use for the organic farming training. You can pay with beautiful traditional handicrafts that we then sell to pay for medicine. Or you can pay with labor that makes everything we do cheaper. And then in addition, in order to further promote conservation, any village that completely stops logging gets a 70% discount on their medicine. Now, everyone can always pay with bartered items, but if you come from a non-logging village, you can pay with fewer bartered items. In this way, men like Pak Sofyan never have to log in order to pay for health care. And with using this system, we can get conservation organizations that care about protecting and restoring the forest to subsidize health care. Because the thing is, we don't have to choose between these two adorable little ones. In fact, the way to save baby orangutans may be to save baby humans, and vice versa. So in order to understand our impact, we did a baseline survey and then a repeat survey 5 years later with over 1,300 households. And what we found totally surprised me. Everything that we wanted to be going down was going down. When we first started, there were 3.4 infant deaths per 100 households. That then dramatically declined to just 1.1 in just 5 years. And then various indicators that we have of disease, like fever, diarrhea, and cough lasting more than 3 weeks, which in our area is often tuberculosis, all also dramatically declined. Even births per mother went down. And then in terms of conservation, when we first started in 2007, there were about 1,350 households that were logging in the national park. That's an estimated number. And then that dropped down to 450, so just this dramatic decline in only 5 years. We now have an estimated 180 people that are logging in the park. And we've started a new program called the Chainsaw Buyback program, and we're hoping with that we will get close to zero. And then what are those loggers doing? They're farming now, right? It worked. In a speech at our 5-year anniversary party, one of the village chiefs said, "In my village, there used to be over 100 loggers. Now there are less than 10. The main difference that I've seen is that because of the sustainable agriculture training, now loggers can become farmers without startup money for expensive chemical fertilizers." In addition, every measure that we have of economic well-being got much better, which suggests that people are not having to sacrifice financially in order to protect the park. So what's the impact of one site? Well, we helped save over 1,500 orangutans. But that's just one of the local impacts of protecting this critical watershed and this forest. But there are also global impacts. Because if this entire forest were to be logged, and then it burned, which sadly often happens after logging, the amount of carbon released would be equivalent to 21 years of Seattle pollution. It's really important to protect these forests. There's also emerging consensus in the development community that what you do may not be as important as how you do it. Empowerment matters. When people feel truly listened to, and they see that the solutions that they came up with were exactly the right ones to bring about dramatic change, they get really excited, and they start looking about for the next problem to solve. This is a picture of our forest guardians. And they come from every village around the park. And they work with their communities to come up with these creative new solutions and then implement them. Now, I want to be clear here. It's not like every single person in every village knows what the solutions are. But rather, by consensus, when they get together, they can hone in on the critical fulcrums of change. Now, I've seen this same thing in other parts of Indonesia, where villages in one region will all independently agree about what it is they would need in order to protect the ecosystems in which they live, either from their own community members or from outsiders. For example, one group of villages told me that if they had fish farming training, water filters, and training of their healthcare providers, they would not need to sell their land to the palm oil companies and become slaves to them. So if people know what the solutions are, why haven't they implemented them? Because they can't. They just don't have access to the knowledge or the resources that would make it possible. This situation was the same around Gunung Palung before we started, and one man described it in this way, saying, "Before this program started, we had no hope." I understand that feeling of having no hope, and I imagine that you do as well. I sometimes feel a sense of total panic, that we are running out of time, and I don't know if the forces of greed and destruction or love and compassion are going to win. But I do know that if we are going to make it, we have to understand in our bones that all of our salvations are intertwined. Because the truth of the matter is that the health of a rainforest in Borneo and the people around it matters to all of our long-term well-being. And actually, what every one of us does matters to everyone else. And we all have something to give to the solution. Imagine how much more we could do if we had a system that matched community-determined solutions with the global knowledge and resources that would make it possible to implement those solutions. If we all worked together to promote life in all its myriad and beautiful forms, I believe that we could bring about a transformation to a just and sustainable world for us all. With those roots, we could grow an amazing tree, because no one should ever have to choose between the health of their family and the health of the environment. I hope that you will join me in having hope, because it truly isn't a humans versus the environment situation. Win-win solutions are possible and necessary, and the means of getting there may be right in front of our eyes, or rather, I should say, right by our ears. We just have to radically listen. Thank you. Thank you.